Okay, we are continuing with our topic, respiratory failure. We have seen in part 1 the definition. Let's see in part 2 the causes. Okay, let's see the different causes of respiratory failure. The causes of respiratory failure can be acute or chronic, but most common forms of respiratory failure can be associated with what? Acute diseases or chronic diseases. An example, acute respiratory distress syndrome, non-cardiogenic pulmonary edema. Then the chronic one, we can take example of pulmonary fibrosis, like in sarcoidosis case, pulmonary arterial hypertension, like in scleroderma. So these conditions can be the trigger, okay, of respiratory failure. Now, this major situation of massive pleural effusion, if the lungs are full of fluid like this, in the pleural space, the membrane that covers the lung, it can suffocate the patient. Now, you can have cardiogenic pulmonary edema, like in the case of congestive heart failure. It can be either due to the muscle of the heart which is weak, or a muscle that is stiff. Okay, both of them can cause problem on the lung. In which way does it happen? Now, if this heart is dilated like this, is failing to pump blood to go to the aorta, it means even the blood that would be coming from the lungs, entering here, they will not have a space to go to. So the blood will remain in the lungs, then the lungs will be full of blood. Then the blood will try now to infiltrate the tissues, okay? So the water from the vessels will be infiltrated in the tissues of the lung. Then it will cause pulmonary edema. The same way here, once the muscle is stiff, then there is no space to put blood from what? From the lungs. So this is very bad because it can suffocate a patient in a very short time. You can see pulmonary edema here. It is showing a very bad X-ray where both sides, left and right, you can't see where oxygen is reaching. Only small areas here, which is not significant for helping the patient to breathe. You can see pneumonia, infection in the lung. Sometimes infection can be very bad. It can affect both lungs. It can be bilateral. This one was segmental in the middle lobe of the right lung. Pneumonia can be a cause of respiratory failure as well. Pulmonary embolism, emboli, if embolus is coming from far away from the lungs, for example, in the legs, if you have varices, it's a high risk, then this embolus will travel until it comes from downwards, it enters the heart. The time the heart now pushes it to the lungs, trying to get what? Oxygen, it will come and block. You see where it has blocked. Now, if this vessel is blocked, then this whole area will become ischemic, then it gets dark infarction, okay? So this will cause as well respiratory failure. Pneumothorax. Pneumothorax can be traumatic or secondary to a disease that can perforate the lung, and the air will pass through the lung inside, then enter the pleural space in this area. Or a trauma, injury coming from outside, then it penetrates through the ribs. Then the air might enter here. Once the air enters here, so the lung will be compressed, then it will cause respiratory failure because the patient cannot breathe. You can see this lung is fine on the left side, but on the right, you can see that the lung has collapsed. This is air outside the lung. You can see that, okay? Another possibility is COPD or asthma, chronic obstructive pulmonary disease. You can see this is a normal tube, okay? The bronchi and the bronchioles, they are open in a normal circumstances. You breathe well without problem, but once there is an inflammation, Like in the case of asthma, the severe inflammation, it will come and block this whole tissue. Then no air cannot pass through. That's very bad. Pneumoconiosis, like people who are in the mining companies, core workers. Previously, the lung was fine, but as the lung get dust over and over for a long time, then it will end up by causing the lung to be fibrotic. It becomes fibrotic, become useless lung now. Then it will lead to respiratory failure. Obesity. Obesity can suffocate a patient. The obesity does not affect the outside tissues alone. It does affect also the tissues in the pharynx. You can see this person is lying, the oxygen can pass through as you breathe in and you can take your CO2 out. But now, when there is obesity, these tissues are thick, they will block the airway. And when you breathe in at night, you are sleeping, the air doesn't have a way to go through, it has time back. So obesity can be a cause of what? Respiratory failure. Poliomyelitis. Poliomyelitis, we know, is a disease that causes paralysis of different limbs or different systems of the body. It can cause this kind of malformation. It does affect any part. Okay, you can see now the lungs are no longer having a normal shape. They are gone, and even the bones are gone as well. So this can cause respiratory failure as well. Emphysema. We know what we call alveoli. Very important to remember that this is a functional unit of the lung and it should be in normal function always. So this is a normal structure. It has many sections, okay, many small sacs together, which help a lot in gas exchange. Now, if now there is a disease that have destroyed them, it will form one big sac, which is a useless sac. Okay, this will cause respiratory failure. Tetanus. Tetanus, we know, is an infection, a disease caused by infection with the bacilli. Okay, bacilli, which is transmitted through injuries with the anaerobic the bacilli, which will enter in the body or penetrate during trauma or during delivery in unclean circumstances. So it will cause paralysis, because the bacilli of tetanus, what will cause, it will secrete toxins that are responsible for paralysis. So if the paralysis reaches the muscles of the respiration, then it might even kill the patient. There are other conditions like pneumonitis, inflammation, infection in the lungs, kyphoscoliosis, malformation of the spine, pulmonary hemorrhage, you are bleeding within the lungs, congenital heart diseases. These congenital heart diseases can cause as well the respiratory failure. Poisoning. The poison might go and cause the muscles of the lungs to stop functioning. Guillain-Barre Syndrome. Guillain-Barre is a condition where the paralysis might start from lower limbs going upwards after an infection, whether a virus or a bacteria. There are some bacteria which can cause those kind of complications. So Guillain-Barre, once this paralysis reaches the muscles of respiration, then it can cause respiratory failure as well. Drug overdose or polyneuropathy. Polyneuropathy, we know nerves of the body are responsible to control movement and sensation. Now, if the nerves are not working, the movement, then it means the chest can be affected as well, and can affect respiration, particularly when we talk about a muscle of respiration like a diaphragm. Myasthenia gravis, autoimmune disease, which will affect muscles as well. Status asthmaticus, a very severe form of asthma. It can cause a respiratory failure, even death. Head and cervical cord injury. Remember, the brain and the nervous system are the one controlling the whole body. Then if there is like a cervical injury, the nerves will be affected, which will end of the day affect what? The respiration as well. So we will see in the following part the different complications, how to manage it, then you can understand this respiratory failure very well. Thank you once again. Please don't miss the following part so that you can understand this topic much better. Thank you.